Joining us live is Dr. Ali Raja, the Executive Vice Chair of Emergency Medicine at MGH. Dr. Raja, thank you so much for being with us on this Christmas Eve.
Thanks, Jessica.
We are seeing daily COVID cases higher than ever, certainly higher than last Christmas when we all stayed apart. But so many experts are careful to say this is not December 2020. Help us out here. What's different?
It's a bunch of different things, Jessica. It's a combination, really, of having vaccines and booster shots. We have masks, especially high-quality N95 masks. We have safety protocols in hospitals. We have treatments that can keep patients out of the hospital and out of the ICU if they do get COVID. And we have rapid tests, even if they aren't all that easy to get.
All right, Dr. Raja, you actually changed your own Christmas Eve plans. Yeah. Why did you dial back?
Well, Sean, here's the thing. We ended up having to do so. We were going to have just a small group of family members over, but some of them had symptoms, so we decided to hold off. But I've got to tell you, even if they were well, the rapid tests that I ordered are delayed. They're not here yet. And we went around and looked for some more, and we couldn't find anybody or any of them. So we would have canceled anyway, because those tests were a really important part of our plan.
Yeah, you just mentioned that, some of them are having symptoms. Something simple, maybe even as sneezing and sniffling, can't even really be ignored at this point, right? It's also cold and flu season. How do we know when it's time to get a test and take extra precautions?
It's really hard to tell. I just finished a shift in the ER, and I had people come in with a lot of symptoms, and some of them had COVID, a couple of them had the flu. And so all these symptoms are very similar. It could be the flu, it could be COVID, it could be some other virus. So the only way to know for sure is to get tested and to take extra precautions in quarantine, even during the holidays.
All right, doctor. So this week, as you know, the CDC changed the guidance on isolation for healthcare workers who actually get COVID. They're shortening the time that they actually have to stay out. I believe it's from 10 days to 7 days. Yep. Is this all about hospital staffing issues?
Sean, I think it is mostly about staffing. There's growing evidence that says that we probably don't need the full 10 days of isolation for COVID if we don't have symptoms and if a follow-up test is negative. And all around the country, we have, and especially here in Massachusetts, we have significant challenges in hospitals in terms of staffing. And so keeping asymptomatic staff who test negative out of the hospital is just placing a burden on even those of us who are in the hospital, like I was earlier today. I got to tell you, I'm really hoping that this allows us to get back to our patients faster if we don't have symptoms and if we test negative.
Dr. Ali Raja, we always appreciate talking to you and getting your insight, even on Christmas Eve and during the holidays. Thank you so much.
Thank you, doctor.
Thanks.